Skin girl, skin just like pearls. Best thing in the world. I never traded you for anybody else singing.
Hello, 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 everyone. Can you hear me?
Yep, we can hear you.
Okay. Hi, everyone. I just want to say hello and welcome you all to the tea. I hope everybody has their mugs. I do. On the COVID-19 vaccines. I would like to thank the NAACP Youth and College Division for presenting us with this fireside discussion on the COVID-19 vaccines, because you know that has been a popular topic, especially this week, because it has affected especially the Black and Brown communities throughout the 2020 and 2021 year. And as summer is around the corner, we want to inform you all on the vaccines and game plan that you may want to have if you're considering taking a vaccine. I hope you are. So I'm just going to introduce myself first. My name is Raven Waters. I am the first vice president of the New York State Youth and College Division of the NAACP. And I am also a board member for the National Board of Directors, as well as the vice chair of the National Board of Directors for the NAACP's Health Committee. So hello, everyone. And I am going to move on to our amazing special guest, starting off with Miss Brandy Fields. Miss Brandy Fields, RN. Brandy Fields is a full and proud resident of Dallas, Texas. She earned her Bachelor of Science degree in nursing from the University of Texas at Arlington in December of 2018. She currently works as a travel nurse where she picks up local and state contracts from different hospitals in and out of Texas. Her background work is in the ICU, where she cares for several patients and on different ventilators and multiple life-saving medications. Brandy plans on furthering her career in healthcare administration. Currently, Brandy is a life-subscribing member of the NAACP. We love that. She has worked with the organization from local to national level. Also, she is one of the first graduates of the National NAACP Next Gen program. Also, she is a financial member of the Southwest Dallas County Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Our next amazing guest is Dr. Jerica Ampadu, Director of the SIUE We Care Clinic and Assistant Professor. Dr. Ampadu has been contributing to healthcare for the past 23 years. She has worked in telemetry, emergency department, quality improvement, and education. For the past 18 years, Dr. Ampadu has been working as a faculty at the SIUE, Southern Illinois University, Edwardsville School of Nursing. She has taught a variety of courses in the traditional BSN, accelerated, and graduate MSN programs, including adult health, didactic, and clinical. Community health, clinical, freshman's first semester transition, and the foundations and assessment and theoretical foundations of nursing. As director of the clinic, Dr. Ampadu is committed to providing equitable access to care to unserved populations. Our next presenter is Brittany Randolph, MS. Brittany Randolph was born and raised in Boston, Massachusetts, but relocated to Florida shortly after graduating from Boston Latin Academy. She attended Barry University in Miami, Florida, where she earned a BS in chemistry with a minor in physics. In 2012, she was a recipient of the Department of Physical Sciences Honor Scholarship and the university's President's prestigious Excellence and Leadership Award. She went to earn her MS in Medical Sciences from the University of South Florida, Morrisani College of Medicine in Tampa, Florida, which was her first advanced degree. After her degree at Morrisani, she went to Nicaragua, where she served as a program director with the international nonprofit community development organization, MANA Project International. Brittany today is currently a graduating medical student at the University of Florida College of Medicine, who recently matched into psychiatry program at the San Antonio Military Medical Center. She has chronicled her medical school journey on her YouTube channel and social media handles at The Brittany Way, where she builds a community of more than 60,000 subscribers and followers. In May of 2021, she will earn her MD and be the recipient of the Military Health Professionals Scholarship. She will commission as a captain in the United States Air Force. Our next special guest is Mr. Clifton Crowley, LMSW. Born in Macon, Georgia, has been active in the Atlanta community since a teen. Clifton Crowley is a licensed master of social work who is a mental health professional, advocate, activist, organizer, researcher, and thought leader in the field of social work. Clifton has worked in the field of child welfare for nearly a decade and has been a licensed mental health professional since 2017. Clifton serves in multiple hospitals around the Atlanta area at both Grady Memorial Hospital and Children's Healthcare of Atlanta. Clifton is a proud member of the Atlanta NAACP. So, ladies and gentlemen, I present to you all of your panelists. Hello, everyone.
Hello, Raven.
Hey.
Good.
How y'all doing tonight?
You know?
I'm doing good. Excellent.
Doing well. Excited to be here.
That's great. So I'm going to start off with an easy question right off the bat. When did you all get vaccinated, and what vaccine did you get?
So I can start. So I got vaccinated. I can't even remember really what month it was, but it was as soon as it was available for medical students here at University of Florida. And yeah, so they sent out an email saying that we were allowed to get vaccinated. I, signed up as soon as I could. And I was vaccinated with the Pfizer vaccine. So that was 2 doses. They were about 28 days apart. And yeah, I am very happy that I feel very blessed and fortunate that I was able to get vaccinated when I was, because I know at that time, it wasn't available to so many people. And so I'm glad that, just that my school was able to offer that to us as medical students.
So we have one Pfizer princess.
I got vaccinated back in December. So I always call myself like the real guinea pig baby. But yeah, I got vaccinated like as soon as it came out, because they was offering it to like the people who actually work with the COVID patients, like right on the front line, like we were offered it first. So yeah, I was real hesitant at first, but I went ahead and got it. Best decision, I could have did right now. So yeah.
Did you get Pfizer, Moderna?
I got the Pfizer.
Oh, okay. So we have 2 Pfizer princesses. Okay.
So I was vaccinated in January, and I was vaccinated with the Moderna vaccine, and I had no side effects.
Oh, that's great. Okay, 2 Pfizer princesses and a Moderna mommy.
Yes.
All right, I'm Team Moderna.
Okay.
It's funny is because I won up everybody. I was in the trials. So I
Oh,
was
wow.
in the clinical trials and I got vaccinated. Well, I got the shot in September, at the end of September, but I got unbinded in January and learned that I actually took the Moderna vaccine. So
Wow.
I'm the supreme guinea pig.
Yeah. You beat my guinea pig.
Right.
I'm just so thankful to have you here today because I've never really talked to anybody or interacted with anybody who's been a part of clinical trials. So that is definitely a great insight to have you here tonight, Mr. Clifton.
No problem. It's a very interesting experience that I'm still going through.
Well, you know what? We might have you talk about that a little bit later.
Okay. No problem.
Okay. So I know some of you mentioned that you didn't really have any side effects, but what are some common side effects to experience after receiving the vaccine, or what are and what side effects may differ in between the different vaccines?
I think some of the side effects is like some of like the COVID side effects. Like I know some people, they got fevers, they got chills, they got the cough, they got the whole thing. Like after, it was, I feel like it was different because some people got the side effect after the first dose, but the more and more people start getting it, like a lot more people start getting the side effects after the second dose. Me personally, I don't really have any side effects like after this because I pre-medicated myself. So after I took the first dose, I took some Tylenol before I went to sleep because I just knew I didn't have time to be going through side effects when I woke up. So when I took the second dose, everybody was like, "Oh, I'm feeling sick." Like, I was like, "Okay, let me take another Tylenol before I take, before I went to sleep." Because the thing was, I was very strategic about it. I took it because I work 4 shifts at work, so I always took it on the 4th shift, and I got it like right towards the end of work. And then when I went home before I went to sleep, I took me some Tylenol, and I was okay. After the second dose, the first day I was okay, but the second night I had like a bad headache. That was pretty much it. Like, so I just took some Tylenol and I took a nap, and I woke up. I was fine.
And I just want to say that Brandy, she said she pre-medicated, and that's okay. And it's okay if you do it with Tylenol, but some people think that pre-medication is with any drug, and you should not pre-medicate with Motrin. So just be mindful if you're considering it and you do want to pre-medicate, just do not do it with Motrin, because what happens is your body, Motrin suppresses your body's immune response, and that's not what we want. We want your body to respond.
Right. And
Thank
also
you for that.
to piggyback off of Brandy, so some of the other side effects that have been commonly reported are, the most common is like pain at the injection site. So pain, redness, swelling at the site of the injection. It's one of the most common. Then other people have reported some nausea, headache, as Brandy mentioned, some fever, chills. I know the main symptom I experienced was body aches, and it was like pretty severe, and just feeling fatigued and tired overall. And so the first dose I got, I felt the body aches. I unfortunately at the time, I don't think at the time that I received the vaccine that the information was like, it was not recommended not to pre-medicate. So I pre-medicated, which is not what is being recommended now. And I still experienced the body aches, and it was worse with the second dose. But would I do it again? Absolutely. And just keep in mind that you are to expect and anticipate side effects. And that's actually like a good sign that your body is mounting an immune response to the vaccination. And so, and that's going to vary person to person. I know plenty of people, and I'm not salty about it, but I kind of am, that experience absolutely no symptoms. And I'm like, well, why did I experience like everything under the sun? But like, so it varies person to person. So just keep that in mind.
I
I'm
didn't have
glad.
any.
Oh, go ahead. Sorry.
I didn't have any side effects. I didn't even know I had the vaccine. I thought I took placebo. It wasn't until January where they said you actually got the vaccine that I was like, oh, okay. Well, never mind then. Because I thought I would have to get the shots again. I did experience pain in my shoulder, but other than that, I didn't realize I even had the vaccine.
Okay, that's great. So I think it's great that you brought up something that is not really in the question, but the pre-medication. I seen people talk about like there being like Tylenol available at the vaccination site. So you say it's better, or you all suggest that say it's better to medicate after taking the vaccine, correct?
Yeah, I medicated after. Yeah, I mean, if you ask me, I would probably, because people like will reach out to me like, should I take it before? Like, you don't just take medicine like before because you don't know what. I mean, I guess that's what pre-medication is, but people who work in medicine, we tend to not follow the rules sometimes. But but I just knew like, Tylenol, because I know like even just with COVID, like I mean, I guess Dr. Ampadu can correct me, like the ibuprofen hasn't really been like, we suggest patients, like we don't give patients who have COVID ibuprofen because it's not really good. So I tell people, don't take ibuprofen. I did tell people don't take Motrin, just take you some Tylenol and you'll be fine. Because even some nurses who were they would come to work, with the signs and symptoms, and they just took some medicine, of course, and they worked their whole 12-hour shift. But I think it just varies from person to person because everybody's body is different. So
Yeah, so I did read on the CDC's website that they are no longer recommending, I don't know if they ever were, but I know now they are not recommending pre-medicating with medications like ibuprofen or things of that nature, like any anti-inflammatory, because you don't want to diminish the body's natural response to, the vaccination, which is like a foreign antigen that we're injecting, and your body naturally is going to mount a response to that. So some of these medications like ibuprofen, like Motrin, like Advil, those things will can potentially diminish that response, and you want your body to build up and fight like it's supposed to against the vaccine or what's in the vaccine.
So you guys know I'm a teacher, so I have to come back. So, and a lot of people, I talk to a lot of people, and they'll say, well, I'm not taking Motrin, I'm going to take Advil. Well, Motrin and Advil are actually the same drug. It's ibuprofen. And with ibuprofen, the mechanism of action is to decrease inflammation. So, and it suppresses your immune response. So that's why you don't want that. Whereas Tylenol is an antipyretic, which works a little bit different with the pain receptors and reduce fever. So there are two different pathways of how they work, although I think we use them simultaneously all the time, so that you understand that there's really a difference in both of them.
Thank you for that clarification. This conversation actually kind of went into our second question, which was just explaining the technology behind the COVID-19 vaccine and like how it responds to your body or your body responds to it. So if anyone else wants to just add a little bit on of just like how the COVID-19 vaccine affects the body, kind of like a under the skin type of thing.
I think I'll defer to the teacher because you did a great job.
I knew that.
The teacher got it.
I had got myself in there. Okay, so this is what I do all day long. So mRNA, which is the messenger RNA, which is the technology that the vaccine is created from. So taking couple of steps back, researchers identified the spike protein on the surface of the coronavirus, COVID-19 virus. Believe it or not, coronavirus is a family of viruses and it's been around. So the coronavirus actually causes adult respiratory syndrome. It also causes the common cold. However, when they identified this specific virus, they identified it based on the outside of the virus. It had spikes, so which is why it's called Corona-19 or COVID-19, because it is Latin for spikes. So mRNA technology basically replicates those spikes that are on the cell of the COVID vaccine or on the COVID virus. And when you get the vaccine, you're actually getting genetic material that is, it's not a live virus, it's genetic material that causes your body to mimic what will happen if you actually contracted COVID-19. So your body, once you get the immunization, your body identifies it as foreign and says, okay, this is a foreign substance in our body. We're going to now produce antibodies to fight against this virus. So essentially, the vaccine does not prevent the disease. It actually prevents you from having a severe form of disease if you come in contact with the virus after you've gotten your vaccination.
Thank you for that.
Yes, thank you, Dr. Empathy, for the save.
That's okay. And then to think about the virus, the vaccines in general. So the Pfizer vaccine and the Moderna vaccine are the two vaccines that are made from that technology, whereas the Johnson & Johnson vaccine is not made from that technology. It's actually a vector virus immunization. So essentially they took a virus similar that looked like COVID-19, engulfed it in some material and then injected. So there is a stark difference between the Moderna, Pfizer, and then the Johnson & Johnson.
Okay, let me sip my tea because Miss Jerica just put it down.
Right.
It's just water, y'all. I'm just playing. So we're gonna move on to our next question, which is, what does it mean for the vaccine to be emergency authorized as opposed to being FDA approved?
You guys want me to go again?
Is
I
Clifton
think the
taking
teacher,
that one?
the teacher.
I should have included that.
My Wi-Fi went out. My whole computer like shut down, like in the middle of her talking.
It's okay, Brandon. We got you back.
So essentially, the Authorization Act, the Federal Emergency Authorization Act, actually allows for us to utilize the COVID vaccine, although it has not had full approval. However, there are stringent guidelines and steps that each company had to go to even get to that point of emergency use. Anytime you get an emergency use, you have to get into the third phase of clinical trials where they're trialing it on actual people. So the only difference is that since it's authorized, it hasn't gone to actually that full board where they actually analyze and synergize all of the data, but it is shown to be effective. So the benefits of the vaccine is more beneficial than contracting the disease. So.
Thank you for that. She is teaching us tonight, spilling all the tea.
So is it basically that with the emergency authorization, like we only get that authorization in situations where it's like a public health emergency, like we're in now, or like with COVID, the COVID pandemic, versus the FDA approval is just like, that's the normal process, which is a lot lengthier for any other type of like vaccine.
Exactly.
Okay.
That's exactly correct.
And y'all feel free to cross-examine each other and ask questions. Like, this is a chat. This isn't just an interview.
Yeah.
So next is, how quickly does a vaccine go into effect? So maybe after you get that one shot with Johnson & Johnson, or maybe when you get your second shot, how quickly does it go into effect? Oh, the second shot.
After you get the second shot, the second dose of Moderna and Pfizer, you're actually fully not vaccinated until 2 weeks after. So don't go out to the streets too soon. Wait 2 weeks.
And that's
you ain't fully covered just yet.
Now the Johnson and Johnson, I honestly don't know because that one's real new. So, but I know like with the Moderna and Pfizer, they tell you to wait 2 weeks, and then you're fully vaccinated, or 95 to 97, whatever percentage number that is.
That's correct. Even with Johnson and Johnson, it takes the body at least 2 weeks to develop full immunity, or the immunity.
And don't forget, y'all, it's the mask for me. Stay masked up. Even though you vaccinated, stay masked up.
Professor, is it when you take the first shot, aren't you like 50% there, and then after the second shot you become fully? Is that how it works?
Yes,
after 2 weeks?
So, and the data varies depending on the vaccine. So for Pfizer, you have a higher percentage. It's I've seen anywhere between 50.8% to 65%, whereas Moderna is like 50% after the first vaccination. And then after the second vaccination, 2 weeks after the second vaccination, you're considered fully vaccinated. So you do have some immunity post for the first shot.
So moving on to our next question, were there any of you skeptical or had any hesitations, which you guys kind of touched on a little bit earlier? If you want to elaborate on like what hesitations you had, or if you had the choice to choose the vaccine that you got, what made you choose Pfizer or Moderna? Because those are the vaccines they received. I don't want to be Pfizer and Moderna only. There's no disclosure, you know.
I work in 2 hospitals, and COVID was going on pretty heavy back in August. And one of my patients died. He was 13 years old. And it dawned on me that all the patients in the children's hospital that had passed were Black boys. Mm-hmm. And I don't know why that is. I don't know if there's no studies or anything, but all of the patients that had died in the children's hospital were Black boys. And, you know, when I went to Grady, they were saying that they had a shortage of minority participants in the trials. And it just dawned on me, and I reflected, and I said, you know what? If there's anything I can do to help my people, I'm gonna help my people. So Emory had a trial going on, and I went to Emory, the website, and they said, you know, I work next to Emory at Choa, and signed up for the trial the next day.
Wow. Wow. Thank you for sharing that.
And to this day, I don't think that's most of the patients that have passed in the hospital, in the children's hospital, have been Black boys to this day. So, and I don't know if Doc, can you, Professor, can you explain to me why that is? I don't know if any studies or anything of that. Why does it seem to be affecting Black males in a certain way?
That's heartbreaking. That's heartbreaking.
Yes.
And I think there are several factors that play into why the African American community are getting COVID at higher rates than other communities. I think, well, and there are several reasons. Well, historically, of course, the mistrust in the healthcare system, and that takes you back to the Tuskegee experiment, or even the story of Henrietta Lacks, if you guys know about her. So we as a people in general are very hesitant and are not trusting of the medical community. And that's a very valid reason. But one of the things that I think that as a community we could do better is getting the proper information out. Once COVID became a pandemic, if you were on any type of social media, everybody was a doctor, everybody was an epidemiologist, everybody was a teacher. And I simply said, I need you all to stop, because that information gets forwarded and it's misinformation. And so we are not properly equipped, one, to advocate for ourselves when we do enter the healthcare arena. So I don't have the words to use when I get there. And we have that factor, and I'm sure all of you, especially if you're in healthcare, you're going to see this a lot, because there's just racism built up in our healthcare system, and there's no way around it. So there are those unconscious biases, and there's racism. So when you have a Black body that enters into the emergency room, is the same care been given to that person that you give to the next person? Or did we sit around and wait to see what manifested? And then when it did manifest, it was already too late. So some of those things play into the factor. And it's research shows, if you research kind of disparities in healthcare, it is a proven fact that the intensity, healthcare providers do not increase their intensity of care when they're working with minority populations. So when we come through the door, they are not saying, hey, this person needs A, B, and C because these are what the guidelines. It's like, oh, she's really not in any pain. Oh, no. So it's a whole different perspective. And it's a reality, unfortunately.
I think, I know with my experience, like I was skeptical at first, because I remember when it was first coming out and everybody was like talking at work, like, are you going to get it? And I was that one person. I was like, no, not getting it. Like it was a no all the way around for me. And this was actually my first travel assignment. So the hospital that I was at, they were offering it for free, but me, no, not getting it, don't want it. I'm fine. I'm gonna let it test it out on y'all first. But what really got me was, of course, since COVID, I've seen a lot of deaths, but it was this one guy. And of course, it was around Christmas time, and I just bought a house, and I knew for Christmas, I wanted to be around my daddy. And, just a couple of my family members, right? And I knew that, there was a patient there, and he was a white male, and he was young. He was in his 60s. He had been a respiratory therapist for over 30 plus years, had COVID, was a pastor, was a veteran, and he got COVID from his son. And that really touched me because, of course, I've been seeing everybody die since COVID started, but I just knew I couldn't face the fact of me giving COVID, because his son is perfectly fine. Okay. And he had like another younger child too. They were perfectly fine. But here he is, sick, dying. Well, he died because he got it from his son. So I had got tested first. I had never been COVID tested since the pandemic started, but I knew that you can't get the vaccine if you have active COVID. So I got tested first. My test came back negative, and literally as soon as it came back negative, I went upstairs and got the vaccine. And I was very adamant about it because it was, and I will say this, it was a doctor there, and they tried to tell me, oh no, you had to make an appointment. And I'm in there with my N95 and my face shield on, and they were asking me, what department I work in. I was like, what department does it look like I work in? I work in the COVID area. And it was this doctor that came in, didn't make an appointment. Of course, he was, a white male, but he didn't make an appointment. He didn't do anything. But I can tell you now, he didn't work with COVID patients. So I was like, they just let him go back in. I said, and I asked the lady, I said, so y'all gonna let a doctor who, I can tell you now, his doctor's office is closed, and try to deny a nurse who actually works with COVID patients here at this hospital the COVID vaccine? And they thought about it, and they went ahead and let me go in and gave me my vaccine. So, and then just to the other point that he made about minorities, I also feel like it's different from what area you in, because I just finished my assignment out in Atlanta, and I was in Emory. And Atlanta itself is a culture site. And when I got there, it was Black capital. Okay. But I know when COVID first hit and I was back here in Texas, I feel like it just hit minorities everywhere. Because the patients that I saw, and I worked in a 15 unit ICU bed, I could take about 13 of the patients were Hispanic population. So I saw a lot of African Americans getting hit really hard with COVID. But honestly, if you ask me, the Hispanics was taking it very, very very hard. And we will be at work and we were just like, what is going on? Like, why is there so many Hispanics like getting hit with COVID? And they were young, and some had comorbidities, some didn't. You know, I met a woman, I had a patient, she was 95 years old, DNR, and she survived COVID. And wasn't on a ventilator or anything. She walking to this day. But I think it just depends on, because there's a lot of different resources out there. I know at down here in Texas, I was at one hospital, and the professor can correct me, but there is an antibody infusion that some people, and I'm going to say some people, are getting, because I feel like it's very expensive. And when I mention it to my family members and I mention it to other people, they have no idea what I'm talking about. And I didn't have no idea what I heard till I was at work, and I had a 95-year-old patient who was DNR and who survived COVID. And I'm asking, like, what is going on? And she had dementia, but she kept saying she had an infusion. And I talked to her family, and they's like, yeah, some type of antibody infusion that people are getting, and you're supposed to get it like when you very first find out that you have COVID, and it's supposed to help you get over, like, it doesn't, what's the word? It doesn't make you get as sick. But a lot of people who are not of minority were getting it. They were able to afford it. And some people who are not of minority who were getting this infusion, they were getting sicker with COVID. But yeah, it's just, I feel like everything is just kind of like, it's like we know, and then new stuff come, and then it's just like, I don't know, just like this infusion stuff. I was like, I didn't know what in the world that was. So, but it's out there.
Yeah, and I'll be quick, but I was initially skeptical at first about getting the vaccine. I was concerned about, like many other people, how fast it was being produced, or it had been produced, if like the correct safety measures had been taken. There wasn't a lot of data out about, the vaccine, and there wasn't just a lot of information, or at least I didn't feel like there was a lot of information out there. And then not only that, there were, the myths and the rumors that were going out there, especially like within the Black community, about infertility and about, I even heard some things about like spiritually and like the mark of the beast and like all of these things that were going around about the vaccine. So I was like, oh, hold up. I'm not, I don't want to fall victim to like conspiracy, but I'm like, how do I know? How do I know that this is not true? So it took me doing some research on my own and like really looking into it. And then ultimately it boiled down to trusting in the science and knowing that like there are very, very the best of the best researchers, the best of the best virologists, and the best of like everyone came together to make this happen. And I had to put my trust in that. And after, of course, doing my research, and just the same way that I would want my patients to put their trust in me. I'm about to be a doctor in a month, and I'm walking into a medical profession where my patients, I would hope, have trust in the information and my expertise and my training, that I'm doing what's in their best interest. And I just thought, like, I hope that I had to trust that like they wouldn't put millions of people, especially like millions of vulnerable people, in harm's way intentionally. And so, yeah, that basically what it boiled down to. And then just the fact that sometimes it takes you being a leader and, being afraid and doing it anyway, because, I'm blessed to have a platform, and I'm blessed to have like a sphere of influence. And, just recognizing that, like, if I'm going to talk the talk, I need to walk the walk, and I need to lead by example and put my money where my mouth is. So that kind of gave me the courage to go for it. And I don't regret it at all. I'm actually very thankful, and I feel very blessed and fortunate to have received the vaccine. And I've actually encouraged some of my family members to get the vaccine too, who were like very anti and very against it. And so and I asked, like, what changed your mind? You know, you did it and you were fine. And I trust in what you say. And I'm like, well, if I told you I needed a Mercedes, like, is that coming too?
No, for real.
Situation's coming around the corner.
Whole family text message out and said Brandy got her vaccine. Like, it was the end of the world. But now a lot of my family members, my dad just got his first shot this past weekend. So
yes,
I don't
And
have
we
any.
all got the computer chip.
Oh yeah, that's when I heard that there was metal in it, and I had to, look that up, and I was like, "There's
All
no
of us
metal."
got chips in us.
See, my thing
Remember
with
Tuskegee? There was a T-shirt, dude.
Go ahead.
There was a guy that had Remember Tuskegee T-shirts made. And he was walking around with Remember Tuskegee T-shirts. And I was like, do you know what the Tuskegee experiment was? And he was like, yeah, they were injecting people with syphilis and stuff. And I'm like, no, that's actually not what happened at all. So just, I don't know. We quick, a lot of us are quick to feed on ignorance, and we'll, perpetuate that quicker than we will with facts. Even if you come with facts, evidence, doctors, and everything else, they will believe someone on the street corners faster. And that's just the level of mistrust.
They'll believe TikTok before they believe you.
Yeah, that's just the level of mistrust. And the fault of that, obviously, there's a historical significance as to why there's this level of mistrust, but also, we're dealing with communities that are just lack of educated in period. There's a lack of education in certain parts of our community, and let's be honest about that. And also the medical field, the medical practitioners aren't there and haven't been there for long periods of time. And because of that, their doctors, the doctors in their community don't look like them, and they don't trust that. And because, due to all the medical apartheid that has gone on within the United States, and we don't have clear representation when it comes in the medical field, there's a lot of distrust, and it's fair. When Albany, Georgia was being struck by COVID, it had one of the highest death rates in the country, even higher than New York, in that small little city. And 90% of those people, over 99%, were Black. And they couldn't, they were trapped down there. The hospital was full. They were sending people home to die, and there was nowhere for them to go. And there's very large number of poor indigent community in rural Georgia, and they suffered from it. So, why would you trust a system that put you back on the streets when you were sick?
I agree with that. And another factor that plays a part in that, you talked about education, but when you think about health and health literacy, even some of the most educated people don't understand some health terms. So I agree with you when you say about providers who look like the patients they serve. And in the medical field, we call that patient and healthcare provider concordance. And so that means that you have a healthcare provider that looks like you. And if you look at most institutions, especially public institutions, there's a big push to increase the number of minority and underrepresented people in medicine for that very reason. Because as we know, as the population changes, the minority becomes the majority, but we still won't have healthcare practitioners that look like us if we don't recruit more people into the profession. And by recruiting people in the profession, we have to work on those institutional issues that prevent the students from being successful once they get into the institution. So it is definitely a pipeline that you have to work through completely to actually see the results of what does it look like when you have healthcare providers that look like you. You will see better health. You will see a decrease in the healthcare disparities that we currently see.
And we're lucky to have the results in front of us today, each of you also working in the healthcare system and just helping your community. So I thank you all for your service. So our Q&A box is on fire right now. So I'm going to have you all, like 1 to 2 of you, answer each question because I want to get through as many questions as possible. So the first question that I saw was from Ava Richardson. Hi, Ava. She said, why are they letting pregnant women get the vaccine?
So is the question why?
Yes. Yes, the question is why. Let me see.
Why not? I guess my question would be why not? When a woman is pregnant, the baby develops antibodies from the mother. So when a baby is born, they're protected against COVID if the mother is vaccinated. There's some immunity already present when a child is born. And actually, research has shown, I mean, I forgot the name of the woman, but the first woman who gave birth to a baby who had COVID antibodies. And that's a good thing because you're now protecting the child whose immune system is very weak. It's not like our immune system. So actually, I think the question should be reversed because pregnant women out of any category, pregnant women should, to protect the baby and themselves.
Thank you for that. So moving on, unless anyone else wants to add on.
She hit it right on the spot.
Exactly.
Okay.
Nail on the head.
So we're going to move on to our next question from Miss Tanika. And it says, after the vaccination, the full vaccination, should masks and social distancing should still be implemented for between vaccinated and non-vaccinated people? So I guess after you're fully vaccinated, should you still be wearing a mask and social distancing if you're interacting with non-vaccinated people?
Absolutely, most definitely.
Yes.
You should still practice physical distancing. You should still be wearing a mask. You should still be washing your hands frequently. Just having been vaccinated, that's a great step in a great direction to us getting back to normal, but we're not there yet. And we're still unsure. They're still studying whether or not, although the vaccine can help prevent you from catching COVID or from having a severe case of COVID, we're not sure whether or not vaccinated people can still pass it on to people who aren't vaccinated. And so you definitely want to still practice these same things that we're practicing now, just for your safety and the safety of those who aren't vaccinated.
And remember, there's a 2-week window after you get your last shot to the time you get your last shot to the time you're fully vaccinated. It has to get into your system. So there's a 2-week window in there. And people have gotten COVID after they've gotten the shot. So just be mindful of that, to wait those 2 weeks out and to continue to stay socially distant.
Thank you so much for that, y'all.
I think
And continue to wear your mask and continue to protect yourselves.
Yeah, and I think it's also important, and I know we hadn't talked about this, but there are variants of the COVID virus. So what happens is over time, viruses, the more they replicate, when a virus replicates, it copies the information wrong. So it's like duplicating wrong information. So what we see now is that the spikes on the coronavirus, which we've identified, well, as people develop immunity, the vaccine is fighting this, the virus is fighting to stay alive. So that changes the nature of that virus. So what you have now may not be covered under the current vaccine that you have. And actually, Pfizer just issued a statement saying that based on their vaccination, that those who receive their vaccination should probably get revaccinated again for that very reason, because of those variants. So, and this information comes out real time every day because we're still actually studying this virus and this vaccination.
So yeah, there's a potential for the variances to continue to occur, especially since we're not reaching herd immunity. Mm-hmm. And what we really want to try to strive for is herd immunity. And that way the virus doesn't have a chance to form these variances. Mm-hmm. But unfortunately, because of so much misinformation, I don't think that's going to happen. So what's going to wind up is we're going to end up having probably to take boosters shots and from here this year, from next year and the years to come, for those that want to continue to stay vaccinated. So, but hopefully I'm going to keep my fingers crossed. This country's going to get it right, and everyone's going to get vaccinated, and we're going to reach herd immunity, and we won't have to have this issue. Right.
So really quick, can we get a definition for herd immunity for anyone who's not in the medical field?
My bad. Herd immunity is when you have enough people in a community that are vaccinated that the virus kind of just sort of dies out instead of continuing to travel and travel and travel. We're not there yet, so unfortunately, it's going to continue to travel. And as it travels, it's going to continue to have variances.
Thank you. All right. This next question is actually a very good question that I never thought of. So Ms. Pam Baldwin says, I've heard that the Moderna vaccination has caused lingering effects of headaches, dizziness, and flu-like vaccines. I work in the health insurance industry and have had conversations with those who are continuing with symptoms of feeling extremely tired after a month. When do you think it is the right time for someone to seek care at their doctor's office or the ER if they're still feeling the symptoms after receiving the vaccine?
I would be curious is if the symptoms aren't associated with the infection versus the vaccine. So maybe the person actually may have had COVID and did not know. I would definitely say seek medical help when shortness of breath occurs, increase in heart rate, anything that prevents the person from doing activities of daily living like they will normally do. So if you can't get to the bathroom without getting short of breath, that is a concern. Mm-hmm. And I wouldn't necessarily go into an emergency room. I would seek out a primary care provider and talk through those symptoms and get under the care of a primary provider.
I agree.
The emphasis on please just don't get up and go to the emergency room.
I knew she was saying
I had my first assignment because, in Texas, we were running out of beds. So I was taking care of patients in the ER. So I got to experience working in the ER, and it's crazy down there. And people, the ER is not a testing center. There are free testing centers that you can go to go get tested. And it came to the point where we were running out of tests because people will come to the ER with no signs and symptoms. They just want to get tested. So please go to your local testing center, Google it, go to your primary care physician, unless just like Dr. I don't want to mess up her last name, but just like the professor said, if you cannot breathe while you walk to the bathroom, that is when you go to the emergency room. If you are okay talking and just like I am, just go to a testing center.
Thank you for that, Brandy. So we have to wrap up. So I just want all of you just to give your short little spiel of what you feel about the vaccine. Should people go out to get it? And like, how do they encourage others to get vaccinated as well? So I don't know who wants to start off.
So I'll use my time to kind of answer one of these questions because I think it's an important question. Someone asked about the Johnson & Johnson vaccine, and the Johnson vaccine is actually on hold. So they're not administering that. And it's because 6 women have developed severe blood clots. And that may seem really bad in the grand scheme of things, but when you think of 6 people who received blood clots, over 6 million people who were vaccinated with the Johnson & Johnson, that's probably 1 in a million. And again, if it was 1 in a million of mine, I'd have a problem. But the risk of developing blood clot is greater if a woman takes birth control, if a woman smokes, even during childbirth. So those numbers, I think they halted the administration of that vaccine to get information out so that we understand how to treat those blood clots, because you don't use the standard treatment. But I don't believe it's a bad vaccine. I think they're doing what we should do in order to protect the community. So I was to answer that question. And again, being vaccinated is a personal choice. I believe in science, and I will always be the first person to say yes. An ounce of prevention is worth a pound of cure. Is greater than a pound of cure.
I'm gonna use my time to answer a question too, because I saw one. They asked what can they do both independently as a collective to encourage people to take the vaccine or whatnot. First off, I would encourage people to stop sharing misinformation. Make sure that you get information from a verified source, a reputable source, before you share it. A meme is not a reputable source. A TikTok video is not a reputable source. A guy on the corner that's shouting outside with a book in his hand is not a reputable source. Get reputable information, get verified information before you share it, before you take in and ingest it all in. I see, questions that have some misinformation in some of the questioning. So make sure you get verified information before you share it. Trust the science. And let me make it clear, these companies want to make money. They don't want to kill you. At the end of the day, Pfizer wants to make billions of dollars off this. So the fact is that they want as many people vaccinated and healthy walking around so they can tell other people, get the Pfizer vaccine, so that they can take the Pfizer vaccine so they can get more money. They don't want people dying. They don't want that bad press. They don't want negative imagery. They want people to live, and they want people to get more booster shots so that everybody can stay and say, happy Pfizer saved the day. That's just common sense. It's a worldwide global pandemic. It's not focused on just Black people. Exactly. So it's not just, so when they say you trust them, I'm like, well, everyone in the world has to take it. White, Black, Europe, Asia, China, India, you people in the United States, whether you're in Georgia to South Africa, we're being affected by this virus. Please get vaccinated. Please try to create herd immunity for our community, for our future, save a lot of grandparents, save a lot of our children, save a lot of us in the process. Let's move forward. Let's get beyond spookism. Let's work with real science and make this happen. Thank you, guys.
Thank you, Mr. Crawley.
Yeah, so I agree with much of what's been already expressed. I am not in the business of trying to convince anyone of doing anything to their bodies that they don't want to do, but I do want you to do your research. Please find people that you trust, that are trusted resources, trusted, members of your community that know what they're talking about, and get with them and make the decision that's best for you. But make an informed decision, and an informed decision that's based on facts and not fiction, and not myths, and not what you see on social media, which can be very, very confusing. I would just, encourage you not to let, I understand that medical, and many institutions in this country have not done a good job at earning your trust, and in many instances have betrayed it. But I don't want you to allow that to keep you from getting something that can potentially save your life and the lives of the people that you love. So just do your research. You already made a great step by coming here and being here and seeking out information. So keep that up and just ultimately make the decision that's best for you and your family.
And yes, I agree with everyone, piggyback on what everyone else has said. Do your own research. Please protect yourself because people are still in the hospitals dying from COVID. And not only are they dying from COVID, they're dying by themselves. So please take that into major consideration, especially if you are vaccinated or not vaccinated and you want to go see Granny and Pawpaw and great-great-grand. Those are the people who we have to stand by their bedside while they pass away, because we can't allow family members into the hospital. So I always tell people, keep that in mind. But yeah, protect yourself, still wear your mask, social distance, do all the things that everyone else has said. And please do your own research. Instagram and all the other social media outlets are not the best. So yeah.
CDC.
Thank you all. Oh, sorry, go ahead.
Sorry. If you're looking for a great place to start at the CDC. CDC
Shout out
has
to
a lot of great
shout-
information.
shout out to Kismekia Colbert or Corbett. How you say her name? Kismekia Corbett. That's
out
the
the
woman
chat,
that
y'all.
designed the Moderna. That's the woman that designed the Moderna vaccine. So shout out to a Black woman.
Shout out to her. Yes.
Shout out
Queen.
to her. All right, thank you so much. We're gonna transition into our last few words, and we're gonna start off with our chair of the Policy and Resolution Committee for the National Youth Work Committee, Miss Amari Fanoy from the great state of Georgia. Hi, Amari.
Hello, everyone. So although we are all aware of the unnecessary barriers that have placed before us due to receiving the vaccination for COVID-19, we must ensure that our communities move forward in ensuring that we are educated and we take the various measures to protect ourselves and those who we love. So there are 7 board members, there are 7 youth reps, and there are appointees who sit on the national board and with the National Youth Works Committee. We are here to serve you. So I actually challenge each of you to reach out for more information about local areas to where you can get tested and where you actually can receive a free vaccination. And also to stay tuned for the informative programs like we have tonight, so that we can ensure that we educate our community on, what's the best practices, how can we move forward, and how can we just become healthy together. But please also remember to get tested and to wear your mask. Even though some of us have been vaccinated, we are not invincible. So I do ask that you please mask up. And also remember to follow us on social media at the NAACPYC_, and also email us or follow us or find us on the internet at NAACPYC.org.
Thank you. So I see some of our panelists have actually dropped their contact information. So just look in the chat if you want to reach out to them for any further questions. And I am going to turn it over to our interim national director, Mr. Wisdom Cole.
Thank you so much, Raven. And thank you to all the panelists. This was a phenomenal night. Thank you for all the great information that was given. This is very necessary, especially as we are entering a moment where young people are getting the access to being able to get vaccinated all across the country. I'm here in California right now, and I'm trying to get vaccinated as soon as possible. And so this information is very valuable and valid and necessary. So thank you all for being here tonight. I want to take a second to introduce you to the Vice President of Campaigns for the NAACP, Mr. Dominic Whitehead. He'll be talking a little more about how the work we have talked about tonight ties into the work that we're doing at the NAACP at large.
Thank you, Wisdom. I hope folks can hear me. I'm outside, so my apologies. But folks can see I am masked up and wearing my mask, and I am vaccinated fully. Team Pfizer over here, fully vaccinated as of last Tuesday. But as Wisdom said, this is an awesome panel, first and foremost. So having this space, so shout out to the Youth and College Division for creating this space and really talking through the importance of vaccination, the importance of misinformation that is happening. I heard a lot of that tonight from each of the panelists. There's a lot of folks on social media who will think they're doctors and know information and providing false information into our communities, and we don't need that. But everything that was lifted up this evening ties back into our COVID trust campaign. Keyword, I didn't say hesitancy. Oftentimes folks think Black folks are hesitant to get the vaccination, and the research that we're doing and we've recently seen is showing that Black people are not hesitant in terms of getting the vaccination. Black folks just need more resources in terms of knowing about the vaccination and then having resources or having the vaccinations provided to them in their communities. But this is connected to our COVID Trust campaign that we're launching in the next few weeks. There's a few things that we're doing. So hearing all of this information tonight really puts a smile on my face in terms of the resources that NAACP nationally will be providing. We'll be launching a website or a hub that will provide information on all 3 vaccines, Johnson & Johnson, Moderna, and Pfizer. We are launching a Rides to Vaccination program. So you think about our LIFT program, almost at Rides to the Polls. But if you think about our LIFT program that we did during the election in terms of LIFT Rides to the Polls, we are teaming up with LIFT and JP Morgan and Chase to actually give folks free rides to the poll, free rides to the vaccinations for them to get vaccinated. Huge portion of the program. So I see some in the chat, get out to vaccination. So using those those pieces. The last piece I will lift up really quickly, of course, at NAACP, we are not endorsing a particular vaccination. So very similar to our stance on political campaigns, we're not endorsing candidates. However, we are providing the resources to our community. And a part of our process that we're doing is four easy things. Continue to wear your mask. I have my mask on right now and I'm outside literally and I'm vaccinated. Continue to get tested even with vaccination. Continue to get tested. And if you're not vaccinated, you should continue to get tested. Continue to social distance and follow CDC guidelines and get vaccinated when ready. Those are the 4 things that we are pushing from the national. Over the next few weeks, there's going to be a lot of collateral, toolkits, a lot of stuff on social media and more events like this to provide accurate information to everyone. So Wisdom, thank you for this time that you're giving me this evening. This is an awesome panel. And shout out to all the work that the healthcare professionals on the panel are doing day in and day out to ensure that our community get vaccinated, because we have to beat this.
Thank you so much, Dominic. I really appreciate it a lot. And like Dominic said, I'm ready to get vaccinated. I know a lot of you are ready to get vaccinated. And so we actually want to even engage and see where folks are at. So I'm about to launch a short little poll. Just, after this conversation and after this research, after this, great information that was given to us, how are you feeling? Have you already been vaccinated? Are you planning on getting vaccinated? Are you more prepared to get vaccinated? Do you still need more information about your options, or are you not interested at all? We want to know what you're thinking, how you're feeling, so we can kind of gauge this, so we can create more events, more opportunities to talk about vaccinations, making sure that you have as many opportunities as possible to engage with the research and the content. As was said before, there was a lot of great conversation happening tonight, but the conversation doesn't have to end here. We're actually having an after the tea conversation at our Instagram at NAACPYC_. So you can go there right now to continue the conversation. My brother Derek Lewis is going to be hosting that conversation with our sister Akia Kalam, as well as many guests who are going to be talking more about their experiences, about their understanding and the research around the COVID-19 vaccines. And so feel free to join us there for that continued conversation. Thank you all again for being a part of this amazing panel and coming here tonight to talk about the COVID-19 vaccination and our options and hearing all the tea. Shout out to everybody who was there before the tea, but definitely want to make sure you were there for after the tea and continuing with all the great resources that are available through the NAACP and through this amazing group of panelists who are here tonight. And definitely please show some love in the chat for our panelists. They did an amazing job, had a great conversation, shared some phenomenal experiences, and educated us all on what needs to be done to support and protect our community. And that is great to see. I'm going to share this poll real quick. A lot of people who are here in tonight's attendees have already been vaccinated. And so that's great to hear that folks have been vaccinated already. People are planning on getting vaccinated. People are more prepared. People still need some more information, which is all right and great. A couple of people saying they're not getting vaccinated, which is your choice. And so I'm glad that you all were here tonight to hear all the great options, all the great information. And let's continue this conversation on our Instagram at NAACPYC_. Alrighty, y'all, and that is it for us tonight. Thank you again for being here with us, and we will see you next time.
Bye, everyone. It was good to meet you all.
Thank
Great job,
you.
everybody. So lovely to meet you all too. Thank you for all your insight and input. I've learned some things myself, so I appreciate, and I appreciate the invitation and to be a part of such an important conversation.
Hey, thank you. And thanks everyone.
Is that an elephant I see in your background? I've been looking at her background this whole time.
Oh, Brandy. Listen, I was 21 yesterday. Yesterday, I celebrated my 21st anniversary in Delta Sigma Theta Incorporated.
Congratulations.
Wow, congratulations.
Yeah. Thank you.
21
years. That means I'm old.
You don't look like your age. I'm just going to say that. You look like you're 21.
I am 46. I am 46. I am 46.
Y'all know what the melanin does not play.
That's
okay.
right.
Don't crack.
You're young. You're young. Don't even trip. You're good.
It's
Good
so
night,
great being
guys.
on here with y'all, and y'all have a good evening. And I might see y'all on IG.
Right.
Bye-bye.
Good
Have a
night.
good night, everyone.
Bye.